morning, everyone. Thank you for being here with us today. We're so excited to have you. The ARC of California is thrilled to announce Caring Futures, a groundbreaking program dedicated to supporting caregivers and family members of adults with disabilities. Understanding the unique challenges faced by family caregivers as they age, Caring Futures offers critical assistance, resources, and a supportive community. Today's Caring Conversation is just one part of Caring Futures program here at the ARC of California. As you see, we have ASL interpretation for our discussion today. You can turn on closed captioning by clicking the button in the bar below. You are also invited to stay 10 to 15 minutes longer at the end for a question and answer session with our invited guest. At that time, we'll invite you to raise your hand and ask our guest directly. Hello, everyone. My name is Felisa Strickland. I am a proud sole parent caregiver for my daughter, Lily. Lily is 23 years old. She has a diagnosis of cerebral palsy, autism, epilepsy, and IDD, and requires full-time care. We enjoy our life and live in Santa Barbara, California. Alongside full-time caregiving, I am a strong advocate for individuals with disabilities. I serve as a board member for the ARC of California, as well as Alpha Resource Center of Santa Barbara. I also participate on many committees and enjoy getting involved in fundraisers and advocacy projects in our community. As a Caring Futures instructor and parent educator, I am thrilled to be here for this important conversation with you and our special guest. Today's topic is public benefits information for caregivers, how to navigate Medi-Cal and housing programs, and what to do if you're denied with a public benefit. I'm so excited to introduce our guest. Paula Kluge is retired as a licensed California professional fiduciary. For over 22 years, she led staff in health and human services, working with Medi-Cal, Medicare, Social Security benefits, long-term care, disabled children, seniors, mentally challenged, developmentally delayed, working disabled, with many forms of income and property. She was the only person reviewing trusts for public assistance programs. She enjoys doing genealogy with her 92-year-old mother, hiking in open space, and traveling the world with her husband, family, and friends. Mrs. Kluge currently lives with her husband of 27 years and her dachshund fur baby.
Hello, Felisa.
Welcome, Paula. Thank you for being here with us today. This is
Thank you. Thank you for inviting me and the staff at Caring Futures. Thank you very much.
Oh, we're so excited. I know this is going to be a really popular conversation. So let's get right into it. We want our audience to get to know you. So Paula, tell me a little bit about what drew you into health and human services, what your career working with public benefits and becoming a fiduciary, and what you're currently doing now.
Okay. Well, after college, I enjoyed working for a county health and human services department, determining benefits for public assistance programs. And I began to specialize and train staff in Medi-Cal and its many programs. After I left that job, I easily transitioned into a licensed professional fiduciary. I think one of the most satisfying and spiritual practices is caring for another. And one of the biggest challenges in doing so is caring for oneself. And I applaud those caregivers out there who can find a balance. I really hope this information I have for you today will help to minimize the stress that navigating through public benefits can cause.
Oh, that is our hope too. Definitely. So as a fiduciary, you have helped hundreds of families navigate through the complex maze of public benefits. I'd love to start with a quick summary of the network of professional services that exist for caregivers and what are the roles for that.
Okay, I'd like to start with Medi-Cal. And Medi-Cal is a special name that California gives Medicaid, which the rest of the country calls that same insurance. All counties provide Medi-Cal benefits. And it used to be that you would have to find a provider that would offer Medi-Cal to you. But now most counties utilize a managed care plan. And some examples of that are Kaiser, Molina, Health Net, Anthem Blue Cross, and Partnership Plan. But you can apply for Medi-Cal by going online to benefitscal.com or by visiting your local county office. So I wanted to tell you about a couple of Medi-Cal programs that I think your audience would be interested in. One is the 250% Working Disabled program. This is for disabled folks who also have a small job. There's no minimum wage or hour requirement, and there's a flexible definition for work. So you can water plants, you can help with shopping, you can dog sit or read aloud or tutor a child, sort recycling, anything like that. And there are also allowances for any periods of unemployment. So there's not a pressure to, have to have this job constantly in case you get a cold or something, you get sick and you can't do your job. It's best for someone who has a share of cost. And I just briefly, I don't know if you know about a share of cost, but it works like an insurance deductible, excuse me. So you'd be responsible to pay your share of cost to the doctor or the pharmacy or the dentist before Medi-Cal will pay for anything above and beyond that. But
Okay.
you can pay a premium in this program between $20 to $250 a month, and that depends on your income. And then you have free Medi-Cal for IHSS or in-home support services. You have free Medicare Part D prescription plan and also free Medicare Part B premium, which right now is $174.70 that gets taken out of your monthly Social Security check. So it's nice to get that back.
Wow. Well,
There,
I didn't realize there were so many different types. Or what other programs are there out there that people might not know about?
There's an institutional deeming program. Just briefly, this is for children under 18 years old who may not qualify for Medi-Cal because of their parents' income being over the limit. So they look at the child's income instead. And this is for children who need nursing level care, but they wish to apply for one of the waiver programs so they can receive care at home instead of in a institutional setting. There's the Magi program that offers a free or zero share of cost Medi-Cal card to those people who have income at or below 138% of the federal poverty level, which right now that's about $1,677 a month for one person. That program uses IRS rules for income and expense allowances. So all these programs kind of have a little different way to qualify for them. Another program is the Aged and Disabled program, and that also offers a free Medi-Cal card to those who are determined disabled or are 65 years or older, and they have a certain income, got an income limit. There's also the Craig versus Bonta program, and that offers consistent Medi-Cal in case you have SSI benefits that you lost, and therefore you lost your Medi-Cal coverage with Social Security. The county will continue your Medi-Cal until they can take a second look at your case and determine what your continuing Medi-Cal is going to be. There is also in-home support services, or IHSS. And some of you have probably heard of this, but it's a program which can pay a certain number of hours of care in the person's home. And your caregiver can be a family, friend, or an outside caregiver. And when I say outside caregiver, I'm usually referring to a local community member who registers with IHSS. The hours are determined by a social worker who visits the home to interview you and your caregiver or family member to decide how much care is needed. And during this appointment, it's really important to point out every single needed service. This is not the time to put on a brave face. The number of hours determined will never really be a full day's worth of coverage. So try to get the maximum amount that you can. And let's see, I think it's around 195 hours a month for those without severe impairments, and up to 283 hours a month for those with severely limited functional ability. You have to get Medi-Cal for that first. So when you apply, definitely either put on the application, if it allows you to, that you are going to apply for in-home support services, or let somebody know when you talk to them on the phone. But IHSS offers things like homemaker services, paramedical services. They offer personal care services, protective supervision, and also transportation assistance to and from medical appointments.
Yeah, I'm very familiar with IHSS. We have that here in our home for my daughter. You've given us so many different Medi-Cal options that I'm sure some of us didn't know about. Can you talk a little bit about housing vouchers?
I sure can. And if you want me to talk later about a couple of waiver programs, I've got that information too. But housing programs can kind of be confusing because every county gets to decide how they want to do their housing programs, and there can be more than one agency handling it. So you usually want to look for the housing authority or the regional public housing authority in your area. Sometimes regional centers can be helpful with this, but regional centers are regional. And so they may not know of some of these smaller programs within a county that might be available. So county social services can be helpful for that. The programs that they offer, some are in the form of vouchers, like the Section 8 program. And those are like approval or notice that the state will pay for all or a certain portion of the rent. And you would use this voucher to find rent anywhere in the country, as long as the landlord agrees to accept the voucher. And the voucher also has portability, right? So should you choose to move again later, you can take that Section 8 voucher with you. There is also a what they call a request for reasonable accommodation. And you can use that to either ask to get the Section 8 voucher for the home you're staying in right now, or to apply for an additional bedroom to be subsidized for a live-in attendant. So again, you just need to request a reasonable accommodation to get those items. There's usually long wait lists for these programs. And then when they open the wait list, you can get on it, but then you're waiting again. So you have to be patient with some of these programs. Your portion of the rent is based on your income, and it's usually 30% of your income, and assets are counted.
Paula, thank you so much for explaining some of those a little more thoroughly for our audience. I really appreciate that. I'd like to just, if you wouldn't mind, could you give us a quick summary of a network of professional services that exist for caregivers and what their roles are?
Yes. So caregivers can be found in places like your hospital, or and care manager is another word for that. They can be found sometimes with your health insurance plan. And sometimes these services are free. Care managers are great because they do just that. They manage everything between you and your hospital or your doctor, all the medical information. These are usually nurses previously, so they have a lot of knowledge. There are care managers that you can hire yourself, and you usually can find those at associations that they belong to, like the Aging Life Care Association. And I believe that we may have some information in the chat on websites where to find these care managers. Another association is the National Academy of Certified Care Managers. They're at naccm.net.
What a
Professional.
wonderful resource. I did not have any idea that that actually existed. I mean, I've heard of services like that, but not actually very specifically care manager. I mean, it kind of says it all, doesn't it?
It sure does. And you know who else can help are professional fiduciaries. And they usually help with things like finances and or medical help.
Well, I was
So
gonna say, you're probably the person to go to find out how all of these work so well, because you just gave us such a great description of what all the different programs are. And I'm assuming, because it's not like when you go to apply for Medi-Cal, they actually tell you all the programs you could qualify for, right? So learning about them is really important and figuring out which one is the best one for you.
exactly, exactly.
Well, you've done a wonderful job explaining all of that to us. I'm really, really thankful that you're here with us today. Um, Important services and support seem to either be in short supply or sometimes denied to adults with developmental disabilities. What should family caregivers know about public benefit regulations, denials, and appeals, rights, and processes?
Well, what you want to know is a couple of things. First of all, they have a lack of staff, and sometimes there's a high turnaround with staff as well. So it makes for a general lack of knowledge and sometimes customer service etiquette and experience. For example, some newer staff might not be able to think outside the box.
Mhm.
Um, but one of the things that you can do is to take advantage of asking for a lead worker or a supervisor to double check the work being done on your case. I think that, opening the lines of communication are a good start with that. But if you hit a wall, then you can always utilize the appeals process. Um, that usually stops any negative action from happening, and it allows somebody with more experience and knowledge to take a look at your situation with fresh eyes. For the Medi-Cal program, this is called fair hearings, and it's not a legal court case or anything. It's very relaxed and casual. You would fill out the back of any notice that they sent you that you didn't agree with and turn it in within a certain amount of time by either mailing it to the address on the form or faxing it. You can even call your local Medi-Cal office or the state directly to request a fair hearing. You don't even have to talk to anybody at the Medi-Cal office if you don't want to. You must request a hearing within 90 days of receiving the notice, and you can retain your benefits while your hearing process is happening if you file within 10 days of receiving the notice. It usually starts by a senior staff member calling you and talking about your situation. And usually that gets resolved right then and there, and you don't have to do anything further.
Well, thank you for clarifying that, because I'm sure it's probably pretty intimidating sometimes for families, and definitely disappointing to go through a denial, but to feel like that you have a process that can actually help you through that is a little more comforting. But it also can be kind of daunting if you don't know what to expect. So Claire, that's good to know that it's not as intense as it sounds.
Exactly.
Yeah. So we're getting to the end of our conversation, but I want to just ask, what is the most important thing you want us to remember about public benefits, that you shared with us today?
Well, what I want you to remember is that there are people out there who can assist with you, like care managers in your, local healthcare organization or hospital, professional fiduciaries who can help with handling someone's finances and medical care. These are people who are licensed and professionally trained. Take advantage of what they have to offer to relieve some of the stress and workload that you have. Also, whenever navigating through public benefit services, ask open-ended questions. Um, get a second opinion from senior staff, and file for an appeal whenever you feel you're not being heard or your benefits are not what you expected.
Thank you. Yeah, that's really great information and hopefully encourages everyone here today to keep going and not to give up.